Check scope को कर लें पहले, make sure कि the scope is, are you happy with the scope? और दूसरा जो आप जो चीज़ कर रहे हैं
Nadeem, we are with you.
Excellent, sir. So, okay. So we are starting the case, but we will give you a brief as soon as we are ready. Okay, let's start off, please.
Hello. Yeah, can you go ahead? Nasir, आप case बता दें.
जी अस्सलाम वालेकुम sir. Case we have patient Maqsood Ahmed, 42 years male with no previous comorbids. He presented with abdominal pain and vomiting for the last 1 week. His workup was done. The workup showed that he had a deranged LFTs with predominant bilirubin. 8.6 was Billy and alkaline phosphatase of 170. And the ultrasound showed a CBD of 0.6 centimeter with 0.2 centimeter ecogenic focus.
Withdraw the scope, please. Withdraw the scope, please. Withdraw the scope.
So we are proceeding for the ERCP.
Excellent. Now withdraw the scope, please. Okay, stop. Let me intubate. Okay, dokie. So we, I'm going to, because I think intubation proved to be a little challenging. That could be because of, but let's assume that Shahid hasn't done as many as we believe he has. So I'm going to intubate this patient to begin with. So I think in general, we try to kind of hold the scope between 20 and 30 because I do not want to sort of move my position on the scope until I'm in the.
हाथ पे focus कर लें, please. We've seen it, but keep the focus on his hand, please. Yeah, perfect. Thank you.
Okay, so I just want to make sure the position of the scope is appropriate for this patient. And I'm holding the scope between 20 and 30. Okay, and then all I want to do is just want to make sure it's a very smooth slick. And I may have to ask my colleague who is actually protecting the airway to lift his left shoulder up so that it becomes easier if I am finding it any difficult. So I'm going to start off, but this is the position. As soon as I hit the junction of the hard and the soft palate, I'm going to make sure that the tip becomes a bit more straight. So it is a bit of a blind intubation, but once we've done adequate number of gastroscopies, then it should not be a challenge. So at this stage, it's fine, it's going in. So tip down, and then as soon as I've hit the junction of the hard and the soft palate, I'm going to do the tip up a bit. Can I ask you shoulder lift kijega? Very good, well done. So that helps me a bit. And I've gone into the esophagus without any difficulty. So I did not push. I just made sure that the movement was smooth, slick, without the advancement is as smooth as possible. Once I'm in the esophagus, I'm going to hand the scope back. Okay? So what we want to do is, I would like you to advance the scope to 40, where we believe the GOJ should be. Okay? Now, I don't want to insufflate any air at this stage. Okay? And once you've gone past, so once you see that, junction of the esophagus with the stomach, so you're still seeing the white, and there you see. So you saw, did you see, stop there please? Did you see going from squamous to the columnar epithelium? Good, excellent. At this stage, what you want to do is, I would like you to insufflate some air in, okay? And what I tend to do is, I just want to make sure that I've aspirated any fluid that is there in the fundus of the stomach. If there's none, then that's fine. But if there is, then I want to make sure the stomach is completely empty. There's no fluid, because we don't want this patient to aspirate later on, okay? Are you okay with that so far? Okay, just do it very gentle. We've got plenty of time here, okay, and we want to make sure that we maximize our training opportunity here, okay? And what I would like you to do is to just verbalize everything that you're doing for us, if possible. So you can verbalize, and then you can make a movement. Is that all right? Let's do it then. Okay. Okay. Excellent. Very good. Okay, so tip up. So gently advancing, and we want to visualize the pyloric canal, pyloric channel. So stop there. What's obviously happening here is that we are heading in the right direction, but we've got too much hockey stick. Beautiful. That's the nice. So before we do any movement, just explain it to me, just for the sake, so that everybody's in the room can understand what we're doing. Okay? And then if you make the movement. Okay?
Even sometimes
Okay. Okay.
I target the top border of the pylorus.
Nicely done. Okay.
My wheel down.
Nicely done. Nicely done. That's fine. Good.
I target the top border.
Yeah, so tip up a bit. Tip up and advance the scope gently. Okay, and stay there. Okay. And now, obviously, you know it's shifting toward you, right? So very, very nice. Bring it back again. Okay. So remember, no force, okay? It should go in nicely. Very good.
Should I move my wheel down?
No, so keep the tip up a bit, gently, and then relax the tip, yes. As soon as you advance it, so now advance, and then that's it. So relax the small wheel down, so tip down a bit.
Then I go towards fundus.
Yep. Okay.
Target the center of the pylorus.
So obviously your tip is there. So once you want to just, if you relax the tip, so tip down a bit. As soon as you advance, tip down. So you actually fall into the duodenal bulb. Very nice. You can do a tip up a bit gently. Okay. So stop there. What actually, if you start seeing it, okay, you actually, your tip is down. So you need to bring the tip up a bit, gently tip up a bit, because you want the sun is not setting here. That's the problem. We want the sun to set. And sun will only set if you bring the tip up a bit. Tip up a bit gently and then gently advance. That's very nice. Okay, so tip to the right as well. Is there a way we can help you here? Would you like us to lift the left shoulder or? Okay, so stop, don't worry. Okay, just think. Okay, what are you going to do differently next time? So with the next attempt, what are you going to do differently? It's okay, no problem. So why don't you just bring the scope back? See how much scope you've got. You've got a lot of scope in. So there's a lot of sort of, what you're doing is you're basically pushing the greater curve away. Okay, you want to bring the scope back a bit, gently. Okay, aspirate a little bit of an air in, maintaining the view without losing the view. Okay. So is there anything you do differently? So don't repeat the same thing again. Would you like us to lift the left shoulder? Is there anything we can do to help you, or your team can do to help you? कुछ हम कर सकते हैं आपके लिए? No, your technique is fine, because obviously a bit of a movement, it's moving away. So obviously it's the patient factors as well. Don't worry about your technique, okay? You are heading in the right direction. It's just a little bit of movement. That's good. Now the sun is setting. See, are you able to advance the scope now? Okay. So why don't we lift the left shoulder up? So let's see. Shall I do that for you? Okay. So let me just lift the left shoulder up. Okay. थोड़ा सा left shoulder उठाएंगे. Okay. Advance. Tip up ऊपर. Tip ऊपर जाइए. Tip ऊपर ले जाइए. Tip up. Tip up. Good. Tip to the.
Nadeem was given the scope. He should be able to get.
Please keep the. Okay, let's stop there. Okay, why don't we bring the scope back, all the way back, please? Okay, all the way back. Suction कीजिए. Suction, good. Nice, very nice. Well done. Okay, now let's just start again. Make sure this, take as much air out of the stomach as possible. Good. Okay, and gently advance along the greater curve, gently advance.
Scope should talk to you.
We don't,
That's only going to happen when you understand what you're doing.
a little bit is fine. Good. Okay, gently advance. Gently advance. Keep the tip up, please. Keep the tip up. Excellent. Keep advancing. Keep advancing. Tip to the right. And gently advance. That's it. It's okay, don't worry, don't worry. Take your time. Don't be fine.
I'm getting into the pancreatic duct and I've got nice, decent pancreatic duct bicannulation.
Let me stop again. Okay. See, by moving your big wheel or tip up and down is not really going to help. You just need to have confidence in your ability that you will get in there. Okay. No, we don't want tip down. Remember, we want tip up, please. Okay. Keep the tip up. That's it. Good. And yeah, keep the tip up and advance.
I think it's actually, you say pancreatic की जो होती है ना, तो you have to understand, you're not
One more time. Tip up.
understand, you're just doing medianized opening the axillary opening, that's all you're doing. If you do a very big
No.
you end up
Again, please. Just let him relax. So let's focus again. Okay. One.
pancreatic duct.
Again.
So if you don't understand, then the bile duct will become very difficult to cannulate after that sometimes. And then
Is what we are doing is your big wheel movement.
So if you're going to do that,
Yeah.
if one does it, I'm sure those who do it, they must be putting pancreatic stents in every day. But there are people who advocate that, I'm sure they have better. Huh? No, I'm sure, and I'm not
Okay.
saying they're wrong. I think their experience is. I personally feel the standard algorithm for most people is what I've said. They would put cannula.
Okay. Are we clear on that? The only thing I want you to do differently this time. Okay. We've all been through this. Okay. Obviously we're.
You get into pancreatic duct, you leave the wire there,
Happens. Okay, none of us are perfect. So please avoid doing this. That's the only thing I want you to do. I want you to bring the tip up and I want you to advance. I want you to keep it at this stage. Okay, please don't do this. Okay with that? Let's do this again. Good. So come back. Show us the sun. Okay. It's not easy, so you're doing good things. This is a tricky one, so that's good. Okay. So you see the sun, let the sun set with the tip up, and good. And I now want you to advance. With it. Good. Are you in? Yeah, so come bring it as close to you as possible. A little. It's okay, don't worry. Let's stop. Do you mind if I take over? Okay. So this is a different one. Okay, this is a tricky one. You've done that we've talked about. However, we are finding it that it's slightly tricky. Change the position a bit more. Okay. So इसका टांग यहाँ पर आ गया. Very good. आपसे मैं फिर दोबारा request करूँगा. Let me take over the scope. Okay. And what I'm going to do is just bring the scope back, all the way back. Okay. I'm going to take the scope all the way back, all the way back, all the way back, all the way back. So you know the same thing as I said to you about 40. Okay. I want to make sure that we haven't got much of a fluid in the fundus, and then I'm going to advance the scope as you were doing. So I'm doing exactly the same thing. Okay. We know this is a little bit tricky, so that's fine. We would like to visualize the pyloric canal again. Can we do this? Can we do this? Can we do this? Yes, we can. And I'm just going to gently advance, gently advance, gently advance. And I'm at the same position as you were. So the same difficulty as you were having. So what am I going to do differently? I'm going to have a look at it again and see. So this is the direction we want to go in. Okay. So my colleagues are helping me out with bringing the, keeping the patient onto the left side. And so this should take me in. Okay, as you were doing, I'm going to bring the tip to the right. I'm going to tip to the right. And I'm going to get some of the air in that hopefully we still haven't achieved the desired result. And I think it's pretty much the same as you were because we were losing out on our position. Okay, so bit of a pressure there. I know I'm pushing this against the greater curve, so the scope is pushing against the greater curve. So tip to the right, and tip to the right, making it not really helping. So again, we want the sun to set in the same direction, the tip up at this stage. Okay, and this should take us in. So I'm making sure I'm not putting any air in. He's a young man. We don't think the stomach is going to be any difficult. But as we discussed earlier, is it the floppiness of the scope? Should not be the case. Okay. So I'm still applying, advancing the scope. So having exactly the same challenge as you were having. So clearly it wasn't you. Okay. Clearly it wasn't you. Okay. So tip is staying in the same position, and I'm just staying there. And my colleagues are obviously applying a bit of abdominal pressure as well. That hasn't helped again. Okay. So, Haji. So, tip to the right again. Pressure, there's a lot of pressure, and that's all dead. So relax again, please. So I did exactly the same thing as you were doing. Maybe I think I persisted because I knew I was in the same direction as you were. So we both did exactly the same thing. So I think probably the thing that I did slightly, that I persisted a little more than you did. And I think that's it. But that is just probably because of the position. So I didn't put any more air in. Now I'm gone in, so I'm going to hand the scope back to you again. Okay. So, okay. Thank you very much, guys. बहुत शुक्रिया. बहुत मेहरबानी आपकी. Okay. So again, so tip up and advance the scope further. Okay. Tip up, advance the scope further. Very nice. Good. Now what we want to do is just want to bring this tip to the right. Okay. Tip to the right. Okay. Okay. If you want to, okay, lock it. And now very gently bring the scope back. Okay, with your shoulders to the right as well. Good. Keep bringing the scope back, 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 keep bringing the scope back. Well done, very nice, well done. Good, and relax. Okay, good. So, can I again share an observation? Okay, so stop what you're doing. Your scope is fine. What you did, just look at me. That's what you did. Okay? So the same thing, if you use your, you would achieve the same thing. This, you're actually putting strain on your wrist. You're putting strain on your shoulders, on your back. That's the movement you're doing. Okay? Whereas, if what you could have also done and achieved the same is by moving your shoulders, staying in the same upright position rather than making this movement here. We're doing it by moving your shoulders. Okay? A little bit of a talk is what you would need it as you did nicely. Okay, so now we are in almost where we want to be. We've just had a glimpse of the papilla. Let's just see if you can visualize it now. So very gently, we want to bring the scope very gently. So remember, step by step, a little bit of air in. Good. Bring the scope back, back, and stop. Please, not too much, okay? So what anything you would like us to do for you? कुछ कर सकते हैं हम आपके लिए? Good. So आप कैसे करेंगे? So we don't want you to bring the scope any further, no further withdrawal. Can you see the papilla, papillary orifice, ampulla? Huh? What's there on the top of the screen? Okay. So stay where you are. get some air in. Okay, your tip to the left a little, tip of the scope to the left or anti-clockwise. Yes, good. Very nice. Little bit. Good, good, good. Is this the papillary orifice? Of course not. Good. Okay. So where are we then? Just gently. We don't want to lose our position. I think it's right next to it. Good. That is it. So now you can see it. Okay. Very good. Well done. Well done. Well done. Very nice. Okay. So there's a small diverticulum. Okay. Now just keep your small wheel to the right. Look, there's a lot of movements. We want to avoid that. Okay. Maybe keep it locked. Keep your small wheel locked. Good. Okay. That's it. Okay, gently withdraw, that's it, and not too much. We don't want to fall back. If you do it any further, you're going to fall back. So tip to the right again. Okay. Ji, quick, throw some water, if you can just flush a bit of a saline. What we want to do is we want to maintain a good position, okay? So I would like you to find, Ji, please inject करें. आपने मुझे वो position बना के देनी है जिसमें आप कहें कि correlation is perfect, okay? So let's see if you can find me the good position. It's okay, that's fine, stay there. Make sure don't fall back, ठीक है ना? You don't want to fall back. So एक screen करके दिखाइएगा please. Screen कीजिएगा, screen. That's good, very good, well done. Okay. अच्छा, very good. So position आपकी ठीक है, stop screening please. ठीक है? Okay, good, very good. Very nice. Bring the scope back a bit. जब आपको ये नजर आना शुरू हो जाए ना, that means you're actually seeing too far deep into it. You need to bring the scope a little back. Good, good, very good. Bring the scope back, 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 and stop. Good. Okay, where is the papillary orifice now? कहाँ पे?
Top right. Top right.
Top right, okay. See if you can withdraw further. नहीं, listen, ये आप जितना ज़्यादा करेंगे ना, it's going to make your life more difficult. Little movements. You don't need to move this a lot, okay? Little movements. Good. Good, 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 good. That's it. That's it. That's it. So we believe that's where we are, okay? So screen again, कीजिएगा, please. ज़बरदस्त, ठीक है, okay. That's fine.
Sir, is there any chance I will drop?
Huh?
I'm too straight. Is there any chance?
Bill, so you want to be underneath it. At the minute, you're just kind of just above it. We want to be underneath it. ठीक है ना? Okay. So maybe just a little bit more flush. थोड़ा सा flush और कर दीजिएगा. और उसको close रखिए. As Dr. Saad Niaz was saying, try to hug it. Go close to it. So tip up a bit. Suction a bit. Good. Good. Suction a bit. Okay, that's fine. Okay. Okay. Now go away from it. So you've seen it. Make sure this is the right position. This is the right papillary orifice. You're not looking at either a minor papilla, which is very unlikely. However, you want to be absolutely certain. So go away from it. Go away from it a little. Yeah. So tip down. Bring the tip down. Good. Tip down.
More?
Further, further, further. Yeah. Suction, please. Suction, please. Take all the fluid out. Okay. Air in now, please. Insufflate. Okay. So those bubbles are not really actually helping us. इसमें इंफाकॉल था? ठीक. ज़बरदस्त. Okay. चलें जी वो कैनुला दे दें प्लीज. थोड़ा सा बेस्कोपैन भी दे दीजिएगा प्लीज अगर पॉसिबल हो. ओके ये आप खुद करेंगे प्लीज़, ठीक है? उन्होंने एरिक ने हम कर दिया, अब इसको आप एडवांस करें. आपका जो ब्रिज है, यू वांट टू कीप ब्रिज लॉक्ड और एलिवेटर अप. गुड. ओके.
Wakar is there. Wakar is Sajid Wakar.
Okay. Good morning, faculty. We're starting with another case. This is a 59 years old male with jaundice and abdominal pain for the past 2 months. His bilirubin is at 16.9 and alphos is 848. We did a CT scan on him that suggested over 10 by 10 soft hypoechoic mass at the level of the ampulla. He has a CBD of 1.3 centimeters and PD is also prominent. So we will be assessing for him for the ERCP.
So, can you hear me?
Yeah, we can hear you.
There are lots of questions on this patient. Dr. Sajda is here, so I mean, I think, should we be doing an EUS first in this patient because he is CT scan wise operable, he's 59, comorbids, diabetic, but controlled diabetes. So, and he's got good functional status. So obviously he's a candidate for surgery if that is, you know, that's the first thing that comes to my mind. And so the question is, I would ask my surgeon if they are comfortable to actually go, if we need to do surgery. I mean, we don't know if this is an adenoma, although I doubt it because with the bilirubin of 16. So Sajda has to tell us 16.9. Are you comfortable doing Whipples if it comes to that? And if that is the case, then the question is, do we really need to do an ERCP? And the answer is no. We'll just go and do a biopsy and come out and maybe do an EUS. If my surgeon says, no, yeah, I'm not happy with 16.9 because by the time I will operate and get everything sorted, the likelihood is that it will go up to 20. Please put a stent in, then we'll go in and take biopsies and put a stent in. So I'll leave it to the surgeon who's sitting with you in the room.
So, Dr. Saad, if the patient is on the list within a week or 4 or 5 days, I'll be happy to go along with that. But my anesthesia team might not be, number one. Number two, for the purpose of the course, I think we should just go ahead and demonstrate the procedure because there's no harm in going in and draining the system right now.
No, so we are going to do that, but I just wanted to discuss it before. So this is a patient where I think, you know, you need to take a step back and see whether what we are doing is what we want to do in the patient, and is it the best thing that we can do for the patient. And as I said, if we go in and this is an operable case and he can be put into a list like Dr. Sajda said earlier, then maybe we don't need to put a stent, we need to do a biopsy and come back. By the way, biopsy will take another 8 days to come back, at least in our setup. So we are looking at least 8 to 10 days before this guy is actually going to be operable, operated upon, I think earliest. So what does the faculty think? Put the scope. So the first thing is,
Saad, I think as the patient is already on the list, I would probably go ahead and do it because if he's obstructed, you might as well drain the CVD. But if you want to get him operated upon, then that has to be done fairly smartly, like within 48 to 72 hours.
okay, go ahead. So we are going ahead, and obviously what we're going to do in normal setting is that we would have had both the scopes with us, so I would have done an EUS as well at the same time. So आप जो कहते देखे ना आपने visually तो किया, you saw the base of the tongue and you're going in, and
Pressing some resistance by this.
so it is your scope position. आपने big wheel को अपने away किया हुआ है. So what will happen when you're doing it away? You're actually straightening it, right? So this wheel towards you or up, as they say. Okay, come back again. Yeah, that's it. Yeah. So we were discussing this, Vakar and Trisha. I mean, there are people who do complete blind intubation with the side viewer, and you can actually do a you know, kind of visual intubation as well. when you're going through the esophagus, I think it's important to be slow, and any resistance should, obviously taken seriously.
Yeah, I think, Saad, it is sort of blind, but not totally blind. It should be
Okay, so now what Dr. Srisha said the other day, if you keep on advancing in with a big wheel up towards you, you're going to turn and you're going to create. So what I would do is I'd come back to the geo junction. Yeah, come back more. Take some air out. You don't need a lot of air there. Go in again. Go in again. Yeah, go in now. Now, so see, where is the ampulla? The folds are telling you that ampulla. So how do you get there? So now you're again doing the same thing. So what I would do, I don't know, what would you do otherwise? अगर आप खुद कर रहे होते तो what would you do?
I withdraw करके मैं
Yeah.
सारी section करके.
ठीक है, okay, good. Do what you do, and then we'll see whether you're. As long as you understand where you have to go and what you need. So you're again doing the same thing, right? You're going to go in. You're going again. ठीक है ना? So come back again. Back again. But this. Just stop. Use your shoulders. Use your shoulders and come back a little bit if you're in the stomach. Just a little bit. Back in. More, more. Okay, now you're in the stomach. So go in, now you can see, right? So you see, pull back a little bit, take air out. We need to go here, right? So what I would do is, I would pull back, do a clockwise turn, more clockwise, pull back, pull back, pull back, pull back, more, pull back. See, this, go. So come back again, pull back, and pull back, करने के बाद your anti-clock, just go clock now. Just go clock, more clock, थोड़ा सा big wheel up, and you should see the ampulla on this side, right? So now you take the scope out, again use your rotation. So your rotation, look at this, look at the scope position. ठीक है? Yeah, do the same thing but without, so you can use, you don't have to use this, you just use this. Okay, and that would do the thing for you for ERCP, right? Tip up करें थोड़ा सा, अब pull back करो scope को clockwise rotation थोड़ी सी देके, just shoulder this side and pull back, pull back, pull back, pull back, pull back. Okay, now advance again a little bit, again clockwise then. No, see you're not. Yeah, take the air out again, and you would only go if you go clockwise. Yes. So you are very entangled. You're not comfortable. Yes. So you need to, you see you're losing the torque here. You see the scope like this? It's not going to allow you. So you create some distance for yourself, right? And then do it. Did you have a loop beforehand? Okay. Chalo. Tip up karo. Pull back karo. Air nikalo. Again, keep turning a little bit more. Yeah, more. Excellent. Advance now. Yeah, tip up. Yeah, okay. You've almost done it. Well done. Remember, if you're doing in sedation, and if you have a large retroverted loop in the stomach, the patient obviously is going to start becoming very uncomfortable. So now you can have your big wheel up and you start advancing. You should see it. And I would keep going and coming a little bit more and straightening. As long as you don't have a big loop, then my patients, here our patients are actually anesthetized, so they are not complaining. They would. Okay, आपका जो scope position है, I'm not. Are you happy with it?
No.
So we need to sit. So just let me hold the scope just for 1 sec. I'm not going to do anything. See, you have a loop here. Anyway, so look at this. You create a distance here, right? Now you see the movement. Okay. So if I have to go in, Now I'm going to just see how I am moving, and I'm not entangled. See there? That's because my scope is straight. If I come here and start doing this, then I have a problem. Okay? So you need to create distance for yourself. Okay? इसको ऊपर करो थोड़ा सा, and now big wheel up करके go in. You should be able to go in. Pull back a little bit again. थोड़ी सी air निकाल दो. Yeah. Again. So it's going on that side. Right? So what are you going to do? इसको थोड़ा सा आप अपने आप को center में करेंगे ना. So what I would do is to use my small wheel. It brings the ampulla right in front of you, right?
Okay.
Now, if you want to, you can actually lock it.
Lock it.
And right now, try again.
ये फिर साइड पर चला गया.
ठीक है? तो अब आप ऐसा करो. You do a give a clockwise. Unlock this. Give a clockwise and pull back a little bit. थोड़ा सा. हाँ, बच्चे इसको छोड़ दे. Leave that. Just give yourself a clockwise torque and build it back. Just gently, yeah. You just need to do a little bit more. Pull it back, 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 back. Right. Take some air out. Right. Keep your position here and try again. Yeah. Go on. Right. Now you know that you're there, so just turn yourself and try and again. Advance karo. No. Yeah, you've got it right here, going. Well done. Excellent. Now, just be gently. All you need to do is just movement of the shoulders, right here. And so whatever you do, what are your maneuvers when you do this? When you shorten your scope?
इनका mid में आना चाहिए, then I proceed.
Huh?
Advance करूँगा.
हाँ ठीक है. जो आप करते हो करो, and I will see. I'm sure you're doing the right thing. Okay. Okay. So how far do you want to go? Just okay. So what do you do then?
Now I will
Lock the
lock the
small wheel.
on to turning to right.
Okay. Tip right
Tip right.
and tip up. Right. And what do? You give a
drawing.
clockwise torque. Yeah. Keep pulling back. Keep pulling back. Slowly, gently. Keep pulling back. Keep pulling back. Keep pulling back. Keep pulling back. I would keep pulling. Keep pulling back. Keep pulling back. Coming to you, that's the time to go tip. You'll be tipped down, so you'll push this thing away, but make sure the scope in the right position. Okay, are you happy? Is this a stable position? Fluoro, please. Okay. That's not thoda sa. You can. Now you need to bring. Where is the ampullary opening to actually sit? And so we need to observe this thing, right? So obviously there is an ulcerated, area in the ampulla. To see where the opening is, and are you comfortable? How is your cannular tip? In what direction is it going to come? And where do you have to go? Where do you think is the opening? So what I want you to do is see what happens when you use the small wheel, right or left. Okay, we'll undo the right, and all I did was we went left, right? So when we went left, we start looking at the ampullary opening here, and if I go in a little bit more, in the right position that I wanted. Okay. Now, can you fluoro again, please? Okay. You think you're good?
Yes, no position is better.
Take some air out, and it will also. Yeah. Okay. Let's take. So you can actually go a little bit closer if you want to. And where is the opening? Before you poke into it, just show it to me. So if you look at it, Jo Trisha was describing, this is the, if you go back again the way you were. See, we were telling you when you're putting the cannula or accessories, you actually move your shoulder and you don't realize you've actually made things difficult for yourself, okay? Now, that's the fun. the, the fundibulum or the end of the ampulla, right? This is the ulcerated part of the ampulla, and the opening is, in my opinion, is somewhere here, right? So we need to go from below up into it. So this is probably where actually is. Again, this is a very good time, and I would suggest to all of you to actually see what happens when you use your wheels, right? What happens when you do a big wheel? What happens when you bring it close to you? See, it's now coming and wants you to hug it, right? So if you want to hug it, then one option you have is you close it here at your stage, maybe lock it and see what happens with the small wheel. And
So do you think there's an opening on the top as well? Is there a
so
fistula?
you can see it. Is this a better position?
Yes, definitely now stable.
Okay. So we need to be very clear where we want to go. We would want to get in first time and we want to poke once, okay? So you don't have to rush, ठीक है? Are you Vakar and Srisha, anybody else, any questions or are they?
Yes, so Saad, we were wondering whether there is a fistula on the top, in the middle. Is
Maybe.
Maybe there's an opening
Yeah,
there.
maybe there is an opening there. But in my practice, I would probably just try and see if we can get in from here.
Okay.
Otherwise, we've seen that as well. Or you want to try, you can go up as well. Then you would go here, right? Screen. Okay. Advance the wire, please. We are in CBD. Fine. We're good. So what do you want to do? Stop. Pause for a minute.
I will definitely go for die.
You want to give die? Okay, give die. बाहर थोड़ा pull back कर लो because I don't like that. Yeah, that's it. Die डालो. Okay, that's enough for me. Now this is a debating point. Do we need to put in more dye?
I think we
Vakar?
definitely go for stent without splenectomy.
Yes, yeah, we need to opacify the CBD, but I think it would be nice to aspirate some bile from there.
But Vakar, my point is why? What is the aim of doing this procedure? We want to put a stent in the CBD, take biopsies and come out. We've already seen where the stricture starts. And so how is the cholangiogram going to help us? My view would be that, more dye you inject, the more likely, chances of infection. So that's what I wanted to discuss.
Sir, you need to get a...
I can't hear you, Vakar, sorry.
Stent splenectomy.
नहीं अभी पूछते हैं ना वायर तो निकाल लो ना एक्सचेंज कर लो वायर एक्सचेंज वकार सॉरी आप I couldn't hear you. No, slowly, right? Be slow. So you need to be.
Saad,
Yes, yes.
we need to get a cholangiogram to see the extent of the stricture, and normally, I mean, we would in our practice take brushings from it as a standard practice, and then once you know where the stricture is, you can decide to put a stent on. Yeah.
So,
Exactly.
so that Vakar would be that we've got an operation here, so we will get a diagnosis from this. See, more likely than in this particular case. The second point is that I've already seen the start of the stricture. It starts from the ampulla to the. So I'm not sure it's going to add any to what we want to do, and hence in our practice, I think we'll just put a stent in and leave it. How long the stent's going to be? Srisha yesterday mentioned. I think a 10-7 would be good enough here. Looking at the stent. तो पिछली वाली picture लगाना है. the first picture where the dye went in.
But I still think it would be nice to know how long the stent is, what is the nature of the stricture.
Okay, can you see the start of the stricture there? I don't know if you can see this. We'll just
No, we
show
cannot.
it to you.
Can you see? I don't think.
Can you see that, Vakar, now?
Not really, Saad.
No, this is lower CBD. You've got an ampullary growth with probably a pancreatic thing, so. Okay, question for you. Vakar, Srisha and everybody there.
Yeah, yeah.
Is there a need for a sphincterotomy here?
Yeah. Yeah, normally I would do a sphincterotomy, especially if I'm going to put a stent in. It's always nice to, you know.
You would do a sphincterotomy?
I normally do it.
And what about Srisha?
No, I personally don't do it, Saad. I don't know what's your practice
Very
is.
slow, yeah. Screen. Go in, wire up, please. You just want to put a 10-7 stent, so we are good. But be slow, okay? Slow. You just be slow. We are not running slow. Wait. See, your position should not be like that, right? What has happened? What have you done? No, you haven't done anything. You just have your scope came out, that's all. So this is what I keep telling. It's not important for you to complete the procedure. It's important for you to understand what you're doing to the scope and what actually is happening. At this stage, I think that's what we want you to focus on, okay? So now you've got a stable position. Make sure that that stable position stays. Yeah, and what you do is you monitor the wire. The yellow blue should not, whichever color you like, you make sure that that it stays where it is. And your elevator is locked, right? Elevator should be locked. Elevator should be down. Because when the thing comes and hits, you will find out. Okay? Also stabilizes the wire and it will stop it coming out when you're doing wire exchange, okay? When you're doing wire exchange, I think it's very important to, obviously it's important to lock the wire, otherwise the wire moves easily. See, stop now.
Now I am feeling.
Now you're feeling? So let go of the, open the lock, elevate, open the lock, yeah, right? Now advance slowly, yeah, that's fine, good, well done. Advance. ठीक है कोई बात नहीं करो. Go on, advance, yeah. पहले तो आप जल्दी कर रहे थे, अब कर नहीं रहे. ठीक है, चलो good. Now you have to tell your tech that he needs to pull the thing out. I will go like this in. I'm going to come out and there you go in. Right?
Repeat.
I go this. I'm going away. All I'm doing is pulling back the scope a little bit, we are in. I'm not using any elevator here, I didn't ask you to do anything. Go on now, advance. Right, fluoro please. Keep going in. थोड़ी सी वायर अंदर चल रही है, उनकी तो वायर को बिल्कुल. चलो जाने दो.
आराम से जा रहा है.
ठीक है, जाने दो. Screen please. Okay, stop. Release, stand release.
Dr. Sir, we are just going to do a TTT pre-briefing. We'll just stop you. You can just put a stent in.
Okay. चलो बेटा ज़रा जल्दी करो. Is he okay? एक मिनट. Okay, release. Pull back. Pull back. Fluoro, please. Okay, all out. Sorry, I had to take the patient because there's a little bit of a drop in the sat, so We have to do biopsy. हो जाएगा इंशाल्लाह. Take the camera off, please. Camera off.